This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs.
Assalamualaikum and hi to ladies and gentlemen. My name is AINAA NABIHAH BINTI and I am your speaker today. Today, I would like to share with you about the symptoms of COVID-19. As you know, COVID-19 is the disease caused by a new coronavirus called SARS-CoV-2. WHO first learned of this new virus on 31st December 2019, following a report of a cluster of cases of viral pneumonia in Wuhan, People's Republic of China. The reason is that COVID-19 is the dangerous disease. This is because people aged 60 years and over, children aged 12 and under, and those who have a chronic disease such as blood pressure, heart attack, cancer, diabetes, lung problems are at higher risk of developing serious illness. But anyone can risk to get COVID-19 disease and become serious ill and die at any age. In my opinion, COVID-19 is dangerous to everyone. Also, the virus cannot using by your eyes. So you do not know who have the COVID-19. But if you have the symptoms of COVID-19, you can go to clinic for the medical checkup. So in my speech, I would like to share with you about the types of symptoms COVID-19. Before I start my speech, I would like to preview of main point. First, I will discuss about the most common of symptoms. Second, I will discuss about the less common of symptoms. Third, I will discuss about the series of common symptoms. First, I will discuss about the common of symptoms. Once a person contracts with coronavirus, a person can take 2 until 14 days for symptoms to appear. The most common symptoms of COVID-19 are fever, dry cough, and fatigue. These symptoms are the early symptoms to people. Fever is doctor consider a temperature is higher to get a fever. A person with a fever will feel hot to touch on their back or chest. Besides that, dry cough is a cough without produce the mucus. Also, fatigue is a feeling tiredness and overall lack of energy. People who feel fatigue can feel weak. If you notice that you or children have the symptoms like that, you must to meet the doctor, and then the doctor can make a swab test. Besides that, you must stay indoors unless seeking medical aid. Second, I will discuss about the less of symptoms COVID-19. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. There are many less symptoms of COVID-19, such as headache and pains, sore throat, diarrhea, conjunctivitis, loss of taste or smell, a rash on skin, or discoloration of fingers or toes. The symptoms can get to everyone, including the children and older people. It can be more seriously when you notice the less symptoms to you and your children. So, in that case, if you notice that you have the symptoms, you must tell the doctor about this. Thirdly, I will discuss about the Series of common symptoms in COVID-19. There are many serious symptoms of COVID-19 are difficulty breathing or shortness of breath, chest pain or pressure and loss of speech or movements. Shortness of breath refers to unexpectedly feeling out of breath or whines. But when should you worry about shortness of breath? There are many examples of temporary shortness of breath that are not worrisome. For example, if you feel very for example, if you feel very anxious, it is common to get short of breath and then it goes away when you calm down. In that case, if you notice that you have the serious symptoms, you must make a medical checkup at the hospital or clinic. So it can help you to make a treatment and doctor must quarantine you at the hospital. Before I make a conclusion in my speech, let me review of the main point. First, I will discuss about the most common of symptoms. Second, I will discuss about the less common of symptoms. Third, I will discuss about the series of common symptoms. In my conclusion, if you notice that you or your children have the symptoms, you must make the medical aids immediately. Also, if you have a contract with people who have the symptoms, you must quarantine yourself within 14 days. You must take seriously in this case because the virus cannot see by using your eyes. Maybe people around you have the COVID-19 disease, so avoid to go the crowded place. It's more good if you just stay at home. Thank you for listening.